Now, the Lagos State House of Assembly is set to investigate the mysterious disappearance of the small intestine of a 13-year-old Adebola Akin-Bright. An ad hoc committee set up by the State Assembly is saddled with the responsibility of probing this incident. Meanwhile, the Lagos State Governor, Babajide Sanwo-Olu, has promised to ensure the boy is given adequate medical attention to restore his health.
Governor Sanwo-Olu is visiting the Akin-Bright family at the pediatric building, Lagos State University Teaching Hospital, where 13-year-old Adebola is currently receiving treatment. This is a story of a missing intestine from a boy who went to a private hospital named Obitox Hospital for an appendicitis surgery at Okeodo in Lagos on the 6th of March 2023. When his case got worse, he was referred to the Lagos State University Teaching Hospital on the 17th of June, where it was discovered that his small intestine was missing.
The boy with the missing intestine.
His mother, Deborah's voice was loud on social media and got Governor Sanwo-Olu's attention.
The question is, where is the small intestine? The other one is denying it. This other, here they said they could not see small intestine. So that's why I had to say, because after the surgery, this boy started shrinking. It's even getting worse. So and I need help. That's why I cried out, Mr. Governor. Because this is the only son I have, and I have only two. So, and I cannot see bear him waste away like this. Adebola is a very strong boy. He has strong will to live, Mr. Governor. Please help me. That's why I'm not trying to blackmail anybody. I just want my boy to live. That's all I want. Because I'm not getting answers.
The governor promised to do everything within his power to get the promising Adebola back on his feet.
I want you to be strong. It's going to be difficult, but I want you to be strong. Don't give up. Okay? We're going to do everything that we can do to get your strength, to give you back your health, to get you back to school. Okay? The whole country is looking at you and responsibility, God helping us to make sure that you get well. Okay? So don't give up. Okay? Okay?
Adebola himself is hopeful that his health will be restored fast. Adedoja Salam Adeniji, TVC News, Lagos.
All right, let's talk this through by speaking with public health consultant Tuyi Mebawadu. We also have medical consultant and chief medical director, Heritage Men's Clinic, Dr. Rashid Abbasi. Thank you so much for joining us on the program this morning.
Good morning. My pleasure to be here.
It's good to see you. It's good to see you.
Thank you for having me.
Yeah, so we've always heard about joys of motherhood, and it's so sad to see, to witness the cry of motherhood. Help us understand. Let me start with you, Dr. Mebawadu. Help us understand what happened or what you think might have happened as a result of the missing intestine, because I felt if that part is missing in the body, it may not be possible for one to still stay alive.
Yeah, thank you very much. I will say two things clearly. One, the health system or the healthcare system or the medical doctors must now understand that clearly you cannot confine medical practice to the four walls of your consulting clinics. In the era of tweets, clicks, media, social medias, likes, and thumbs up, healthcare has actually metamorphosed and moved into the public space. It's used now to trend and drive traffic. Please note that. Those days, so we have moved to health system 3.0, where you have to engage the media, where you have to engage people that are involved in health, both the consumer of health and people that are monitoring health. Very clear, okay? You will get to my flow. Secondly, the second thing is that media itself, okay, should understand that health reporting is not just like every other reporting. Health has its own complication, and I'm challenging media houses to do a lot of deep training for people that are actually doing their health reporting, so that, again, we can get a clearer understanding. Now, let's look at this boy. It's so sad that a young boy of 13 years will have to go through this kind of experience, okay? And the good aspect of it is that the governor of Lagos that came in and said, listen, I'm going to take charge of this. I want to also challenge him that we shouldn't limit to this boy. There are a lot of people that are critically ill and cannot afford some expensive thing. Let us figure how to bridge the gap for them. Now, what we know in the public space is that the young boy, Adebola Bright, was in an hospital for a procedure. Okay? He underwent the procedure. After some months, came back with some issues. They had to actually go in again, try to correct those mistakes. And in the process, a lot of things happened. I said, okay, wait, we cannot treat this boy. We're now going to refer you to lawsuit. Now, on getting to lawsuit, probably there was interaction between the parents and the doctors, and they said that, listen, for whatever reason, this part of intestine had some problem. Let me tell you, what we call short bowel syndrome is a common, it can occur in some conditions. If you have inflammatory, bowel disease, if you have what we call colitis, a kind of, enterocolitis, whereby infection sets in, complication sets in, there is bowel obstruction, you can lose part of the intestine. The blood supply to the intestine can be compromised. Once the blood supply to part of the intestine is compromised, you have no choice than to resect it. Resect means that you have to remove it. It won't be useful. A gangrene can occur along the line of intestine based on a lot of conditions. And you see that this boy can fit into that narrative. But what has happened is that, because we know, in my public work in Lagos State, I spent how many years in Mercy? 10 years working in Mercy Teaching Hospital. And I understood clearly complications that can come from a lot of things, from some of the things we neglect. Okay? Now, I don't want to actually preempt what the outcome of the investigation may be like. But what I know exactly is this. If you're a medical doctor, now, please listen, doctors, or healthcare provider. If you're a medical doctor, as your client is coming in, set up an interactive face. This is what we'll see. This is the likely outcome. Do you know this? Do you know that? And record it. Okay? Now, as you progress, also discuss the progress of the patient. When you take any tissue from the body, either the placenta, either the intestine, whatever, either the foreskin of the baby, hand over to the caregiver, hand over to the parents. Don't say that they will go and throw it away. Listen, this is what we took away from your distance. Hand it over. So it becomes very clear to them. I'm sure those kind of things might have happened in the course of this thing. Tell you what, the whole intestine is about 600 cm or so. Some can be a bit more. When you lose half of it, either as a result of infection, either as a result of enterocolitis or compromise of blood supply to that part of the intestine, from obstruction, from volvulus, any of those things, they have to resect it. It is the practice anywhere.
So reset means to
remove, to cut it and discard.
Cut it in the middle and
you cut that aspect of and join it back. When you have to reset, when you reset more than 50%, the person has no choice to undergo what we call total parenteral nutrition. What else? How do you get absorption?
Okay,
I've just run up in that regards now. So now, what has happened is that is sensationalization of this reportage. Tell you what I experienced, in my journey abroad and interaction with medical people is that as you are coming in, there's what they call, a counseling room. You enter, the doctor enters, or your relative enter, the doctor enter. You have discussion, you ask questions. This is done every other day until the patient is discharged. Every other day. We have to actually imbibe that.
Interesting. It's quite interesting, Dr. Abasi. From the story, we found out that the boy was treated, for typhoid earlier this year. Could poor treatment of, typhoid have resulted into a ruptured appendicitis, that it was later diagnosed for, according to what the mother said?
Yeah, it's actually a very, very sad case. I don't think this is a case of organ harvesting. I think it's a case of incompetency and poor medical infrastructure. And now it's now gone beyond the mistake because there is a lot of cover-up. So if you look at the genesis of the boy's unfortunate case, let's give credit where it is due. So the governor has set in as a responsible human being, not even as a politician. He sets in because he's a father. So he's doing what is the right thing. But it does not need to get to this stage. Let's take a step back. So this unfortunate boy was taken to a private hospital for what is called, quote-unquote, ruptured appendix, We all know that one of the complications of ruptured appendix will lead to a small bowel obstruction, because only God knows how long that has been going on. So he was operated, and few days later, he needed to revisit the hospital again where complications occurred. So now, talking about what my colleague has said earlier, it's totally on point, because it could have been as a result of ischemic bowel, it could have been an infection, it could have been necrotizing fascia. All these will lead to the loss of that small intestine. The small intestine cannot be transplanted in Nigeria, not even in Africa. So it's not about being harvested. But in order to prevent this kind of situation from occurring again, we need to take a step back and look at the kind of healthcare situation we have in Nigeria. Who licensed the first hospital where they went to? We have hospitals in Nigeria, in Lagos, where you get there, they don't have x-ray machine. They don't even have oxygen. It's not only the case of Adebola, unfortunately. We had another one in the social media of a northern woman who delivered a baby that had jaundice, and the hospital had no phototherapy. Jaundice, as we all know, once it gets into the brain, it causes irreversible brain damage, kernicterus. Now the boy is blind. The governor cannot be going in and stepping in every time. So we need a board. We need accountability. The medical community should be the one championing this, because there are so many places where they've dropped the ball. The incompetence is one. That's medical malpractice. And this has been going on. I mean,
Are you saying this incompetency is coming from the earlier place where the mother must have taken the child, or could it have been Lasut?
Absolutely, they all now, because
they've been back and forth. Lasut said, not claiming responsibility. The other is also pushing, just blame game, between the two medical facilities.
Yeah, so there is a big cover-up. There is a big lack of transparency, because on arrival to Lasut, if Lasut had done the needful, which is what we do abroad, you come in before pre-op, you do all your investigative studies, they would have done what my colleague advocated. Have the family members, give them the information that, look, Adebola is here, we don't know where he's been, this is the situation we have. So there would not be cover-up, or there would not even be the perception. And then, who was the surgeon that attended to him at Lasut? Why is the surgeon not stepping out? Why does it have to take the crying mother to call the attention of the governor? But again, we're just dealing with the symptoms. Let's look at the old healthcare, the lack of infrastructure, the training of our medical doctors. Have we had any curriculum change in so many decades? No. And so we're sending our doctors out there. It's like we're sending them to the battlefield, and we're not giving them all the tools they need. There's got to be transparency and accountability.
Yeah, it shows that there's a lot that we really need to uncover unravel really in this particular episode of this gentleman. But we need to take a break and be back. We'll have much more conversation with the doctors that I have in the studio with me. Do stay with us. Thanks for staying with us. We've been talking about the issue of the young boy, the 13-year-old boy, the Lagos State House of Assembly, which is also set to look into the issue that is affecting the 13-year-old Adebola Akin-Bright, as the governor has definitely waded in. I've been speaking to public health consultant Tuyi Mebaodu, as well as Dr. Rashid Abasi, who have been trying to make sense of this knotty issue that Nigerians have finding very, very mysterious, because a lack of understanding. But you said something before we went on break. You said that the intestine cannot be harvested. And I feel that you might be misunderstood, because in the era where we have people who are afraid of, people who are harvesting organs, they're trafficking organs, they're trafficking people to harvest their organs, that maybe this could have been the case. Could you try to expatiate on what you're trying to say?
Excellent point. So I am strongly convinced this is a case of medical incompetence and not organ harvesting. It's not the case of, they need to steal my son's kidney or my son's intestine for it to be sold on the black market. No. If you look at the genesis of this is a 13-year-old boy that was taken to a private hospital, quote unquote, having abdominal, what we consider abroad as an acute abdomen. It turns out to be diagnosed with a ruptured appendix. One of the complications when a little boy, any boy, appears or presents to your facility with a ruptured appendix is you have to do the needful and make sure you exclude complications like small bowel obstruction. When small bowel obstruction sets in and is not timely addressed, it's going to lead to what is called ischemic bowel. There will be no more blood flow. When that bowel is dead, it's no longer harvestable. It's not something you can transplant. So that's why I believe strongly that it was some medical doctors that were incompetent in the field of medical practice, and now it's covered up. It's either from the private sector, now coming to Lasut. Who was the first surgeon that attended to it? Let me give you a scenario. So I'm in Washington, D.C. You bring a 12, 13-year-old boy to me. If I'm the surgeon in this case, there has to be preoperative clearance. There will be a cardiologist that will clear that this boy needs this. He will be able to survive my surgery. A pulmonologist will be there. EKGs will be done. Lab work will be done. CT scan will be done. All these are things that the infrastructure provides. And that allows me to know that, oh, wow, is this going to be a 2-hour surgery, 4-hour surgery? Do I need backup? Do I need to call other consultants because of possible complications? Doctors are human beings. They're not angels. We know, so we should be able to accommodate for that. But in this case, none of this was absolutely done.
Right, Dr. Mebaudu. Well, Madam Deborah, that's Akin's mother, claimed that lawsuit showed her, only a part and not a complete video of the surgery they carried out on the boy. Are there hospital laws that forbid, making public a full surgical operation?
What happened is that let us appreciate the fiduciary nature, okay, of healthcare delivery. Most of the time, even if you and your wife come to me for care, for me to disclose your issue to her, I must take your permission. You don't just throw out people's information like that. That is one of the rules that guide medical care. Of course, but it doesn't mean that you cannot do a proper documentation. And that's why, in essence, the most important thing in health is actually documentation. You have to put everything down here and there. But we look at the health system because, listen, I had been in public practice with Lagos State government for more than 21 years. But yes, in the past, I can understand some of these things that's happening. I remember there are a lot of issues in our healthcare system. There are outside the hospital issues, inside the hospital issues, and post-care issues. Even pre-care issues is such that you see people coming to the hospital even late, for their care because of their limited understanding of what their health issues are.
You mean reporting the
yes,
hospital?
Yes, even for, because again, you ask yourself, how do you get to a ruptured appendix? I don't want to even mention. Yes, okay, so okay, it might be just the ignorance of the mother, okay? After having said that, okay, but we also need to do a proper documentation and care, at the level of having to do the surgery. We know what are the likely outcomes, and we must explain that to the parents in clear terms, very clear terms, and document. Do you want me to go on or you don't want me to go on, okay? And then the third thing is that I want to allow the different committee or different groups set up to look at this, to do their work. I'm not going to prejudice any of those things. But the fact is that it's not the Lagos State House of Assembly that should be doing this. It's not Lagos. You see, we have in the medical system, we have the schemes of checking on things up to the Nigerian Medical and Dental Council. That is where we are now. What is Lagos State Assembly's business about that? What do you understand about the details of medical care? Even if I have to sit down and start, explaining enterocolitis, why would they get to understand the various complications?
Yeah, do not forget that some of the politicians are also...
No, forget it. I'm telling you. The medical, when you look at it from the level of Medical and Dental Council, everybody necessary to understand the depth of care and the protocol of care, they are there. Have you done this? Have you done this? Have you done that? Okay? So, but what this one is pointing to, like I said, is, listen, doctors, hospitals, don't run away from the media and social media engagement in your doings. Don't think that, they can say anything is not going to matter. So you mean
they would have owned the narrative? They will have probably...
But you have to be careful how much of it you have to really give out. But documentation becomes, again, a key important thing. And then patient engagement. Let me give you an example. We used to see a lot of people in Massey Children's Hospital those days. These people will have advanced TB, small children, advanced tuberculosis. I look at it and say, what is happening? This is a society that loves children so much. Why are we having advanced cases? But what happened until I went to Uppsala University, in Sweden? I did a study, the care-seeking behavior of these mothers. There are delay stations. First and foremost, there's a power structure in the family. It might be the grandmother who will say that, listen, in our family, when you cough, this is what we give. And the woman cannot do anything beyond that power structure. That will cause a reasonable delay. Then there are other people who run around the family and say, Yalagbo, Iya this at the corner. Those ones will also give their own treatment. More delay. By the time it gets to the hospital, we're seeing an advanced case. By the time you get to the hospital now, test, cards, everything, another lengthy delay. So in reality, if you want to touch health, you have to look at that spectrum. Because in reality, you cannot do much if you don't touch down those level of interventions and what to do. But I want to caution doctors. We are entering an era of litigation and all those things. Guys, document properly. Document properly. Interact with patients and let them know. Let them sign the necessary papers. Because at the end of the day, you get the rap. You get the negative imaging. I saw a radio station devoted 2 hours of their airtime discussing this thing. And I wondered that what is going on here? Were they going to throw us under the bus if we're not careful? So please, as much as possible, do all you can within your power to ensure that, you document and save life.
Dr. Rashid, when people do not understand something, they tend to, blow it out of proportion based on sentiments, based on experiences and all of that. And you can't blame people, for their reaction, because this is all about life, which has got no duplicate. So do you feel that, because look at this boy in the center of this whole story, he's so frail now, he's in very bad condition, and you try to make us understand that this is not a case of organ harvesting, as far as you know.
Yes.
Right. But what exactly do you think this boy, what can be done for this boy? Because if it's supposed to be a treatment, a procedure to bring him back alive, then he shouldn't still be bedridden.
Absolutely. And we need to, besides, I don't want to be just going back and giving credit to the governor for stepping in, because the boy's case could be worse. It could have gotten worse, like so many thousands and millions that just end up dying. So his own case now, where it is, can be arrested to some extent. The mother had alluded in one of the videos that we saw on the social media that it will cost her an average of about 69 to 70,000 naira to feed the boy on TPN, because he does not have any small intestine anymore.
So if there is no small intestine, is that the way the boy is going to live forever?
Unfortunately, yes, because now he's not going to be able to eat the kind of food you and I will eat. The way your GI system works, which starts from your mouth all the way to the back end, you need a part of your intestine that processes and leads to absorption. He doesn't have that. So all he has left now is the colon. That's their body. So they have to be giving him TPN, which is already processed, semi-digested food, and it can only be taken into his vein. So he has a long road ahead. If the governor is actually committed to what he said, his care will need to be transferred abroad. Trust me.
So would there be need for a transplant of that intestine, that is the small intestine that is missing? So can it be transplanted?
So depending on what the situation is now, they will need a GI surgeon to come on board and see. Because when you're talking about transplant, that's another bag of worms. He has to be committed to long-term anti-rejecting medications if he's actually a candidate for that. But we do have patients like that in the US that lives a normal life, but they just have to be on TPN. But again, let's step back. We are talking about Adebola now. There are thousands of people like this. It does not have to be in the case of a surgery that went bad or incompetent doctors. We're talking about taking people to LASU, to Luth, with uncontrolled hypertension, and doctors treating them and just normalizing the blood pressure without following protocol. No, we do not need the Lagos State government or the Lagos State Assembly to be intervening now. We need boards. Everywhere there is a medical delivery system, there will be checks and balances. Doctors, again, are not angels, so we know they're going to be prone. But don't let's put them in a situation where this happens every day and day. If I take it personal, this is the case where I lost my mom in 2008. They took her there with uncontrolled hypertension, and a doctor was telling me on the phone that, oh, don't worry, mama's blood pressure is now normal. I said, wow, that's the last for my mom. And she died. Did Dr. Sanwo-Olu, did any governor step up? No. So in order for us to prevent this from happening again, we need to address our healthcare delivery system. We need medical intelligence. That's how we know the data. How many of these doctors are doing this? What kind of infrastructure do we have? We're licensing hospitals that should not even be hospitals. Some of these places, a lady in the north gave birth to a baby with jaundice. Jaundice is expected with delivery at times. You should have phototherapy. And so-called hospital has no phototherapy, and the baby became blind. The governor is not going to step in. The State Assembly does not have any business with that. We need the board. We need the Medical and Dental Association to step in.
It shows that there's a whole lot of issues.
Let me just put this in the spectrum of healthcare system. There's what we call input, there's process, there's output, there's outcome. Okay, most of the inputs are actually from government. Okay, you don't actually. Hospital is not building. Let's get it straight. Hospital is mainly equipment and human resources, competent human resources, and proper clinical compliance system. okay, clinical governance system. Okay, now, if you set up an hospital and you're not putting phototherapy, you put doctors there, phototherapy machine, you put doctors there, what do you want them to do in essence? You're not putting any BT facilities there. Even they want to use blood, there's no blood. What do you want them to do in reality? If before we can start, demanding the right bang for the bucks, we must be able to put the right money there. We must be able to put the right investment there. Healthcare is fun, it's money. Because those equipment, now what are we talking about? We are talking about application of artificial intelligence into the healthcare system. They're not cheap because human life is not cheap. So until we figure out and say that, listen, how do we fund the health system? How do we put the right thing there? How do we start setting standard like his hospital in where he's talking in Washington, D.C. or anywhere? We cannot just start demanding, what we don't. So government needs to do that. After that is done, of course, I know that you also must put on a proper protocol of care. You will not easily get to hospital abroad and somebody will start looking at you and start giving you IV straight. No, they have to do a lot of checking. It will appear like delay to you. That's why you cannot easily get abroad and say you're going to buy antibiotics. Nobody will give you.
Sorry, Dr. Mibaudu. I want to puncture some of the claims that when you get abroad, we tend to see the abroad, so to speak, quote unquote, as the apogee of administering quality healthcare. Maybe they are just there. My younger sister, who gave birth earlier this year, complained about the fact that she was neglected in the UK. She was neglected. And thank God for the fact that her mother, the husband's mother, was there, who is also a medical provider. She was the one backing at the nurse. You need to move closer to her. You need to touch her. She's losing strength. And then the woman, the white doctor, could not do the right thing, which ordinarily wouldn't have happened in Nigeria. So how about that kind of, not true to move away from the issue. Yes. The point I'm making is that it is not always rosy.
Because again, you know what, if you gauge a quality of care, you understand that you put 100 people, and try to see, to care, what is the outcome of those 100? What you're going to get there is that the majority of them will actually get very good response. There are a lot of high-tech, touch equipment has been updated, training has been updated, check has been updated. That's why we're saying. So what we're saying now is that if you want to replicate that here, that input is essential. You cannot, put a building and put scanty material there and asking the doctor to go and do miracle. Then go to church now. Just go to church. There are a lot of them that are doing miracle with this thing.
Some basic needs must be met.
It's not even basic. The equipment must meet to the standard you are expecting, both in human resources, both in equipment, both in, before you start setting standards of what should happen in the hospital.
Right.
No, like the case of your sister now. So those are the kind of situations we're trying to reduce abroad. Again, I said doctors are not angels, but we need to have all these checks and balances in place. So that is one off, and trust me, if they follow the normal protocol, the nurse in charge of your sister will need to account. That has to be accountability. In Nigeria, we don't have that. Our healthcare delivery system is non-existent. Let's call a spade a spade. If not, there will be more unfortunate cases of Adebola. So in order for us to try and arrest that now, we need to go back. I said this earlier to the new administration. Our healthcare system is so bad that they actually have an opportunity to lay a good foundation moving forward. Because this should not be the case of the State Assembly. We're talking about how do we license hospitals in Lagos. You're talking about 5-story building and they say they have OB-GYN clinic. There's no elevator, there's no power. How do you expect a pregnant woman to get there?
And there may be no ramp.
No ramp, yes. Who gave them the license for that? Trust me, I applaud Governor Sanwo-Olu stepping in because he's acting not as a politician, as a responsible, caring man. But we need to step back and say, how can we prevent this from happening again? Because there are unfortunate cases, not only of Adebola, that goes on now as we speak.
Okay, so let me come back to you, Dr. Mibaudu. Could these insinuations of whether they harvested Adebola's organ, could it have been avoided if the mother was granted access to witness the surgical procedure? Are there any laws that require that a caregiver, I mean, someone who is the guardian or the mother or the parents or who is representing the patient, should not be allowed to witness medical procedures?
let me tell you how the flow should have been to me. Probably they do it, probably they didn't do it. So, you know, first and foremost, this is a case referred from a private hospital. The mother sits, the father sits, or the other person sits. Because you cannot just be one person. Your set of doctors also sit across on this table in a counseling room. That's what we call the room. It's a counseling room. It's a space for that interaction. Yes, we've looked at your son. These are the conditions. These are the conditions. We're going to do this and this and this. We may see this and this and this. And then when we do this and this, we have to do something like this. This is the aftercare once this thing happens. Right from the beginning, the mother is aware, or the people, the relatives are aware of the likelihood. Now, the second stage is that, now, for you to see what we're doing, we put on this thing and there's a place you can sit in the theater where you can watch what is going on.
Translucent glass.
Yes, you can even see what is going on. Please, Madam C, this is what we're talking about. This is what we're talking about. This one is not viable again. Because of the ischemic bowel problem, it's not viable again. If you put it inside this, if you leave it inside this boy, it's going to die. There's nothing you can do. A dead tissue cannot stay with the living tissue in human body. And a pus cannot stay hide everywhere in human body. You have to, evacuate it. So the mother understands that this is where I am. Okay? Now, when you finish the procedure, yes, we have done this. The tissues that you harvested you take from the procedure, you cut away, you resect it, you bring it out. Madam, this is the tissue. Can we hand it over to you? Because sometimes we tend to overact. Do we dispose it? Do we hand it over to you? And that is what most of us used to do to the placenta because of the cultural perception of what is possible. This is your placenta. Take it, go and dispose it the way you want to.
I understand I read something somewhere that some people eat the placenta. I don't know.
You know, there are a lot of mental cases now. Don't just leave those people alone. Right. So, then you show them what was taken away from the boy's body. This is it exactly. What do we do? Okay? Please help me dispose it. I don't want to see it. Okay? You help me document that. You help her document that. Right. And then you now go back the second day. Your boy is in this situation. This is what we need to do. This is what we need to do. This is what we need to do. Do you have any question? Okay? That patient caregiver engagement is becoming so pivotal in healthcare now. We must not run away from it. And those things must be documented. And these are the things that they've put into the healthcare practice or, clinical practice in other places. Not really abroad per se, even in other places that I really want to look at the flow of their health system. Right. So now, for me, I'm telling those medical people to actually consider that. Those thorough documentation. It can be an issue if you don't document properly in healthcare.
Like what we are experiencing.
What we're experiencing now. So then another issue is that the media, okay? Media is about clicks, likes, trending. And anything that could make them trend, they will go for it and push it.
Right.
Medical reporting is not just like every other reporting. They have to do some deeper training. I am sure if they had come to Dr. Abasi and said that, listen, we saw this kind of thing. Can you enlighten me? Dr. Abasi will have put them down.
Okay, so we'll put that at the tail end of our conversation.
Yes.
What the role the media is meant to, play in reporting accurately, representing the medical industry, the medical sector, in order to help the people consume the right information rather than sentiments. But then, before we get there, I heard of a story, people who are reacting to this Adebola issue, saying that when she was meant to undergo a surgical procedure, there was a tattered man who was in the hospital. She mentioned the name of, no, I think she didn't mention the name of the hospital, but there was a tattered man, a man who was not neatly dressed with a doctor. And they were having a conversation with the doctor, and she didn't know what was going on. And she was maybe, what did they give them? Is it sedation?
Sedation,
just to make them, yeah, exactly. And she fell asleep. She didn't know what happened, but she was praying. By the time she woke up, what the medical procedure was meant to have done, maybe they were able to do it or not, but she got the feedback from the nurse that she's got a lot of fat, so they may not be able to get to some of her. So she felt that there was an underhand, a shady dealing that was meant to have gone on. What does this say about who should be in the theater, who should witness what, and how can people trust the system and the process?
So we're talking about layers and layers of issues, which necessitated my suggestion that we need to go back and look on the foundation of which our healthcare system is. Because it's okay to say you want to invite, even with child delivery, you invite the husband, the prospective father, and everything. Some of the family members do not have the stomach to withstand the operating room. And so, but in this case, this is an underage, Adebola is an underage boy. His mom, his parents are there to give signature. The least of which the medical community could have done is not to be anti-transparency. Like my colleague said, just be open. Your own documentation is for you. That's how you transfer knowledge. Because if I'm being on call 24 hours, if I'm going to transfer my patient care to you, you need to read my documentation to know what has actually transpired. In this case of what you're bringing is that your surgical suites, your theaters should be controlled. It should not be the environment where you even have people in plain clothes, because that can easily lead to contamination and all these things we're talking about. So there should have been restriction, but that's not the job of the Lagos State House of Assembly. That's the job of the Nigerian medical community, where there must be protocol. There is policy and procedures everywhere else abroad. When we talk about US, we talk about Canada. They were not built overnight. And fortunately for us, some of these facilities were established by Nigerian trained doctors. So it's not that we don't have the brain cells. So there's got to be something environmentally here and our condition of practice that is leading to all these lousy, I still feel strongly, is a case of medical incompetence. And the case that you alluded to. So if somebody that is not meant to be in the theater, to the extent that if my family member is being under anesthesia, somebody else can even overhear. That's a violation of medical privacy. It shouldn't be. So in a lot of ways, yes, the governor has stepped in to be able to help this little boy, but there is more that needs to be done. And a lot of it should fall on the medical community. The government can step in with the power of enforcement, power to provide the needed instruments, the needed infrastructure. Because, again, this day and age, why would somebody deliver a baby and there will be no phototherapy when you know that jaundice could be a complication? We're not talking about that now because, yes, she's not a Lagosian, but she's a Nigerian. The case of Adebola is one out of many. We have to understand that. What is going on with our medical curriculum? To the extent that we don't even, nurses cannot report doctors. I'm yet to see a nurse that will come out and act as a whistleblower. Because this case we're talking about, the doctor did not operate in isolation. The doctor just did not come up and operate and then sew the boy back. There were other surgical associates. There were assistants. There were nurses for the aftercare. Why are they not talking?
Let me quickly jump in with this. We know that there are three parts of small intestine: the duodenum, the jejunum, and the ileum. Just like you say. So now they say that a part of his duodenum is still missing, just like you've also alluded to, and it's still present, but the ileum and the jejunum is missing. Is there any complication that could make this thing disappear?
I feel strongly that was from the ruptured appendix. This is where the appendix is. This is where the ileum is. The ileum is just like the beginning of your large intestine, which is the colon, quote unquote, a body. So if the appendix had ruptured, that means it had actually got inflamed. It had pus, like all this infection collected there. So how many days, how long did it take the mother, the father, to bring the boy to a medical attention?
So could he have presented with some symptoms, some signs and symptoms, which maybe if they have reported to the hospital earlier on, they would have mitigated the effect or, addressed the issue quickly?
Absolutely, all of the above. So they came in because of delay to present to medical care, which is so common with Nigeria, because we need to point the blame where it is. We don't have a lot of educated consumers. So they present late, whether it's for family, cultural reason, or even lack of finances. But now, what about the first medical person that saw the boy? What was the documentation? How transparent was it to say, look, what I'm seeing now is a medical urgency, is a medical emergency. I'm going to take out the appendix. Yes, there could be complications because it's already ruptured. And if you look at the medical literature, ruptured appendix has a significant amount that will lead to bowel obstruction. Bowel obstruction will cut off the blood supply to the intestine. That intestine is dead. And leaving a dead intestine in the boy is actually more of a medical malpractice. So they did what they needed to do. But why are they not talking? Why are they covering up? There has to be transparency.
And there has to be punishment. This is where I want you to comment.
Yes, okay.
We've heard about stories of medical negligence, which both of you have spoken heavily on, where surgical procedure must have been carried out, and they said the doctor forgot needles, forgot some sharp objects, and which normally shouldn't happen. I just feel probably this is a myth, but you know better.
We've
cases where this
we've gone
happens.
beyond that.
Well, cases where
beyond that
cases
now.
where this happens, are there punishments? Are there legal procedures? Are there ways of, 7 punitive measures on so-called
Of course, you see,
practices?
medical practice is self-regulatory practice. I can tell you, because you go through a lot of processes. Let me even start with this case of this young boy now, Adebola. In the theater, you might have up to 7, 8, 10 people in the theater. So where will there be
business there?
No, not business. Working. Okay. Anesthesia is there. The assistant is there. Scrub nurse is there. Assistant nurse is there. The doctor is there. The main surgeon. The assistant is there. A lot of people are there, performing different roles. Where will there be now that say, okay, you know what? Let's cut and go and harvest this. Go and sell this thing. It's not going to happen. You see, doctors that I know, the little I know of them is that they pride. It's a lot of suffering to get that certificate. It's a lot of suffering. They won't trade it for any stupid thing. And, okay, well, let's leave that aside. Now, medicine is a self-regulatory care because in your training, you are trained on 3 critical aspects. Deep thinking, okay, assemblage of unlikely symptoms, then working cooperatively with people, because that's why, and then ability to interact with human beings. That's why you do a lot of oral exams and all those things. Now, there are rounds. Rounds are layers of people, from the house officer to the consultant and the big consultant. All of them follow around. What have we done? Discussions, options, look at books, what have we happened, the incident, what do they do in this part of the world about this kind of thing? That is, then secondly, after even that round, there's what they call a grand round, where everybody will sit down, your unit will present, that one will present, that one will present. You will be self-critiqued. And then you see some even officers, having to lose promotion. You see officers having to be demoted. You see officers having to have their like sales officer, their time extended. That's right. And reprimanded. I can tell you, except it has changed. You understand? But again, there's a point where, we can actually be a sort of discouragement to enthusiastic medical practice, by negative press reportage. By dwelling on that negativity, by saying that, by not even having to understand the whole spectrum. Yes, of course, there must be a lot of compromise, some compromise somewhere for we to get to this point.
You're big on medical reportage.
Yeah, on media.
Are you saying that
you know what?
There must have been bad representation of what had happened?
Yeah, you know what? Not bad representation. There's a disinformation, there's misinformation, there's weaponization of information. We have to be careful with this. You know me now. I was here during the COVID. I was virtually every time talking about COVID, why we should do. So it got to a point where the information was weaponized and used to attack everything possible. The church weaponized it. In this situation, don't let us weaponize information, to whip, to attack, to denigrate. Do you understand? We can only do that when we have the complete spectrum of understanding of what it means to do health reporting. Okay? If I say that somebody lost bowel, and somebody is quality harvesting, they're 2 different things. If somebody has necrotizing enterocolitis, ischemic bowel problem, and you have to reset, it's a different thing from harvesting. So again, and those are the tiny words people play with. And then they run with it. They used to say all sorts of things without understanding the depth of what happened.
That's right.
So, and of course, when it comes to actually, being open, there's a limit to what you can say about patients. There's a limit. I cannot just come and say that, you see that person, and she was HIV positive, the husband chased that away, this and that. There's a limit. Yeah. Privacy, because you signed to that. Fiduciary aspect of medical information is key. And you have to really gauge it. What do you say, what don't you say?
That's right.
Before it becomes another litigation.
That makes a lot of sense. So it's very important for those that are, listening to both of you experts, talking about this issue, to know that at what point should they present themselves, or should they, present themselves for medical checkup if they are seeing certain symptoms. You were saying that Nigerians are not always very quick to report issues to the hospital. A lot of us are, we are culprits.
Guilty as charged.
Guilty as charged. I was looking for the right word. So, at what point should Nigerians go to the hospital, regardless of whether you have money, or you don't have money, and the role of the government in this.
So to answer your question, the only reference I have is where I have been practicing for only God knows how many decades now. Nigerian healthcare delivery system, quote unquote, it's a three-legged stool. We have the primary healthcare, the secondary healthcare, and the tertiary. In the United States, we have the primary healthcare where you and I can present to our primary doctor's office Monday through Friday. Some doctor's offices open on weekends to attend to a little headache, running stomach, temperature. And then we have the urgent care. The goal of primary and urgent care is to reduce the number of people that will end up in the emergency room. Nigeria does not have that situation. We don't have that urgent care.
But the symptoms of appendix
Yes.
comes and it goes sometimes.
Yes.
When it comes and it goes, does it feel like it's no longer there? Or some people will feel like, oh, it has gone. I don't feel the pain again.
So appendicitis is considered a surgical emergency because of what we are talking about. You don't want it to get to a ruptured stage. Appendicitis, itis means it's inflamed. If it's inflamed, even just driving and getting on a bump is going to make you have what is called peritoneal pain. Your abdomen, and you might be ready to throw up. He's a 13-year-old boy. That's where you think, who are his caregivers? That's where someone, but then they may have been handicapped because they may not even have a primary care doctor. Their PHC may not be functional. We have 30,000 PHC in Nigeria. Only 20% are functional. So they may not have access to that. Hence, they end up in a private hospital where finances could be an issue. But let's just talk about the gloomy thing. What are the solutions we're likely to have? So that's where...
Okay, I thought you were going to say something about the solutions.
Yeah, about the solutions.
In less than a minute.
Exactly. About the solutions, that's where we're talking about the medical intelligence. Medical intelligence will give us data-driven. That's where we're going to know what are the infrastructures we have and we don't have, and what are the things we need to do. How many doctors do we have? How many have JACPA? And what does the government need to do? Our government should not be bogged down with this.
Absolutely. Lots and lots of questions requiring answers, and I believe that those who have watching us will definitely take a cue from some of these mistakes that would have happened on the aspect of the patients and also the medical caregiver. Thank you very kindly, public health consultant Tuyi Mebawadu. Thank you so much for your keenness of insight, as well as medical consultant, Chief Medical Director, Heritage Men's Clinic, Dr. Rashid Abasi. It's always a delight to have both of you on the show.
Thank you very much.